Today, we're talking about scars, those marks that sometimes appear on our skin after injuries, pimples, or other conditions. When the skin gets injured and bleeding occurs, your body immediately starts the healing process. Blood forms a clot to stop bleeding, and collagen fibers are produced to repair the damaged tissue. As the wound heals, the skin may look different from the surrounding area. Sometimes, a darker or slightly raised mark can remain. This is called a scar. It's normal to wonder, will this mark go away completely? The answer depends on several factors. Small or shallow wounds often heal with minimal marks, and over time, they may fade. Deeper cuts or injuries may leave more visible scars, which can gradually improve but may never disappear completely. A scar is the body's natural way of healing itself. When the skin gets damaged, whether from cuts, burns, or acne, the body produces collagen fibers to repair the wound. This repair process forms a scar, which can appear slightly different in color or texture from the surrounding skin. You might wonder, why do scars appear on some people more than others? Factors like skin type, genetics, wound care, and the severity of injury or acne can affect scar formation. Now, let's talk about acne scars. Acne scars are marks left behind after pimples or cysts heal. Unlike normal scars, acne scars are usually caused by inflamed or damaged pores and can appear on the face, back, chest, or even legs. While all acne scars are scars, not all scars are from acne. Some scars result from injuries, surgeries, or other skin conditions. Understanding the difference between scars and acne marks is important for proper skin care and treatment. Remember, every body heals differently. And for serious concerns, always consult a doctor.